Well, let's shift now to a health issue and the need for breastfeeding for newborns, which is a cause that has been long promoted by health professionals and natural living advocates. But a new report out today by the World Health Organization and UNICEF put some hard numbers to the concerns over the scope of the issue. According to the report, an estimated 78 million babies, or 3 in 5, are not breastfed within the first hour of life, putting them at higher risk of death and disease and making them less likely to continue breastfeeding.
And data collected from 76 countries showed 3 main reasons preventing it: feeding newborns food or drinks, including formula, the rise in C-sections, and gaps in the quality of care. Now, earlier studies showed that newborns who began breastfeeding between 2 and 23 hours after birth had a 33% greater risk of dying compared to those who began within the hour. So joining us for a little more of those actual takeaways is Dr. Laurence Grummer-Strawn. He's an author of that report and chief of nutrition at the CDC, joining us now from Geneva. Laurence, great to have you with us. So for you, what are the major takeaways? What is the headline that people should be remembering from this report today?
So you gave the statistics just a few moments ago to really describe how bad the problem is. We've described this as capture the moment. We really want to change the quality of our healthcare around the time of birth so that we're not putting up barriers to breastfeeding, but instead we're actually providing women the support they need to really get started right at the very beginning, and that they don't create problems with breastfeeding so that they can't continue on.
What is your recommendation to governments on how to actually fix this? Because the problem is, I would argue, a bit more dire than most people actually imagine.
So really the main thing is we need to educate our health professionals, probably even before they come to work in hospitals. Part of the pre-service training that they get in medical school needs to tell them much more about breastfeeding and what the right procedures are to support breastfeeding. Oftentimes, our medical system is so focused on doing special tests and procedures that we actually forget how Mother Nature works well to actually get started with the right kind of prevention that babies need. We know that breastfeeding protects against many diseases, and in fact, worldwide, we could save 820,000 lives every year if we actually follow the recommendations around breastfeeding.
Laurence,
so breastfeeding does save lives.
Well, there was recently a report about an event this past spring in Geneva, the WHO looking to push a resolution on the importance of breastfeeding, an apparent shift from the United States, from the Trump administration on that. Is there a change in policy, particularly in the U.S., in terms of how important this actually is?
So we work at the World Health Organization here, and I can't really speak to the policies of any individual countries. We just know it's certainly the policy of WHO and of UNICEF that we really want to provide the best support to mothers and babies throughout the world so that they can start breastfeeding early, they can continue exclusive breastfeeding for the first 6 months, and they'll continue that breastfeeding out for 2 years. Those are our recommendations for essentially all babies. We know there are a few exceptions, and we have to have infant formula in those few exceptions, but those really need to be medically handled as best we can. So we really need to have much better education and better policies for our hospitals, particularly to make sure that we're giving babies the right kind of care they need.
Laurence, the formula industry is a huge multi-billion-dollar industry. They, of course, are going to advertise their product. Is enough public funds going out to get the kind of message that you want to convey across?
No, certainly not. We need much more investment in supporting breastfeeding. Some of it is about getting better messages out about breastfeeding, but it's also about educating healthcare professionals. It's about countering that marketing. We really don't need to have as much advertising of formula as we do have right now. And many countries have actually put in place regulations to cut back on that advertising, not necessarily shut it down entirely, although in some places there are bans on advertising of infant formula. But we want to have stronger legislation, and we want to have better enforcement of that legislation.
All right.
So yes, there is more advertising that can be done, but it's also controlling what the kind of messages are that the infant formula companies can put out.